The content provided in this video is for information and demonstration purposes only and may not be appropriate for all clients. This information is not intended to replace discussions with your doctor or other care providers. Please consult your doctor or care provider about activities that are appropriate for your medical condition. Hello and welcome to the Saskatchewan Health Authority's comprehensive guide on preparing for hip and knee replacement surgery. If you or a loved one is scheduled for a joint replacement surgery, it is normal to have some anxiety and questions about what to expect around the time of your surgery. By understanding the process and following some simple guidelines, we can help ensure a successful outcome and a smooth recovery. You may have received a hip or knee education booklet, but if not, these can be found online at the website on your screen. So let's get started. Selecting your coach. Your joint replacement journey should start with you selecting a coach. A coach can be a family member, a caregiver, or friend who can provide physical and emotional support, help with daily activities, and ensure that you follow your post-operative plan. Your coach can also help you communicate with healthcare providers, ask questions, and will help you to remember everything you need to do to recover properly. Having a dedicated coach can lead to better outcomes and a faster, smoother recovery. Therefore, it is highly recommended that, if possible, you have a coach present throughout your entire joint replacement surgery, including viewing this video. All about your joint replacement.
You have arthritis, and that means you've worn out the cartilage that helps your joint stay stable and run smooth. Arthritis can lead to pain, instability, and poor function. A joint replacement is a surgical procedure that replaces part or all of the hip or knee joint with an artificial joint made of metal, plastic, or ceramic. You are never required to have a joint replacement because surgery can come with its own risks. However, if you are already booked for surgery, then both you and your surgeon will have agreed that you have enough arthritis, pain, and dysfunction that you're willing to take on the risks of the surgery. To perform a joint replacement, your surgeon will make an incision to access the joint, then will remove the damaged cartilage, and will resurface and replace the damaged joint with a new artificial one. For knees, you can replace part of the joint, such as the inside, the outside, or the kneecap, or you can replace the whole joint. There are many types of replacements, and the decision for which is appropriate is usually made by your surgeon. If there are multiple options available to you, you will have that discussion with your surgeon when you're booked for your surgery. For hip arthritis, you usually replace or resurface the entire hip joint. The components can be press fit in or cemented.
Start preparing now.
It's always best to be prepared, and that can start right now. There are some things that you can do while you're waiting for your joint replacement surgery. Learn about your surgery. Talk to your doctors, nurses to learn about what will happen before, during, and after your surgery. Stay healthy, eat healthy food, exercise if you can. If you do smoke, try to quit smoking before your surgery. If you have other health problems, it's a good idea to take care of them so that we know you're healthy and ready to have your surgery. Make an appointment with your family doctor. Let them know you're going to have a joint replacement surgery, and they will check into your blood pressure, your blood levels, things like that. Get your home ready, make your home safe and comfortable for when you come home after your surgery. Make sure that things are well lit. Get rid of anything that you might trip over or any loose mats that could slide around while you're walking. It can also be helpful to make pre-made meals for when you return home after surgery. Make meals, have them in the freezer, things that are easy to cook, especially if you are on your own during the day. Keep in mind around the kitchen, anything that you normally bend down for, reach up for, bring that to waist level for when you come home from the hospital. You'll find it difficult to bend down and reach for things that you normally do reach for. There is good evidence that shows people do better the sooner they are up and moving around and the sooner they're out of the hospital back home where they're more comfortable.
Exercises before surgery. We recommend you start these exercises as soon as possible while you are waiting for your surgery. They can also be found in the hip or knee booklet. Start with 3 repetitions of each exercise with each leg. Gradually do more until you can complete 10 repetitions of each. Hold each position for 5 seconds. Repeat your exercises twice a day. The following exercises are for those waiting for a hip or knee replacement surgery. Knee leg press. Place a sheet around the middle of your foot. A piece of plastic or a plastic bag under your leg can help with this movement. Actively bend your knee, using the sheet to give added bend. Then straighten your leg against the resistance of the sheet. Quads over a roll. Knee straightening. Place a towel or a roll under your knee. A coffee can or rolled up towel works well for this. Lift your heel off of the bed until your knee is straight. Sideways leg slide. Lie on your back and slide your legs apart as far as you can. A piece of plastic or a plastic bag under your leg can help with this movement. Keep your kneecaps and toes pointing to the ceiling. Return your legs to the middle. Standing hamstring. Hold onto a countertop or sturdy chair for balance. Bend your knee so your foot moves toward your buttock on the same side. Be sure to stand up straight. Do not lean forward. Standing hip abduction. Hold onto a countertop or sturdy chair for balance. Keeping your knee straight, move your leg out to the side as far as possible. Be sure to stand straight. Do not lean. Toe raises. Hold onto a countertop or sturdy chair for balance. Rise up on your toes by lifting your heels as high as possible. Be sure to stand straight. Do not lean. Chair push-ups. Sit with your hands on the arms of a chair. Push down through your hands to lift your buttocks off the chair. Hold for 5 seconds. Lower yourself down slowly. Pre-admission clinic.
Before your surgery, you will have a pre-admission clinic visit. This visit will be either done in person or over the phone. It's a very important step in getting you ready for your surgery, and we do encourage you to bring your coach with you to that appointment as well. Once you have a surgery date, you will receive a call to set up a date and time for this visit. During this visit, we're going to talk to you about any medical conditions you have, any surgeries or injuries you've had in the past. We will ask you about any allergies that you may have. We'll also go through all of your medications with you, whether they're prescription or over the counter. Or having your visit in person, we'll ask you to bring those medications with you in their bottles with their labels.
Certain medication may need to be stopped prior to surgery. You may have some tests done at the pre-admission clinic, such as an ECG, blood work, or an X-ray.
Your surgeon might also ask for you to see an anesthesiologist or a medicine specialist, and you will see them during this appointment.
You may have pain and instability that restricts your movements before or after surgery. There are tools available such as raised toilet seats, shower seats, tub benches, and more to help you with daily activities and to move safely. Not everyone will need all of these, but your safety is extremely important. You should not put yourself at risk of injury. A physiotherapist or occupational therapist will help determine what you need and where to get it. It may be best to plan to have equipment for about 3 months following surgery to help protect your joint during daily activity. It is very important to have any required equipment before you go to the hospital for surgery. Having the equipment in place ahead of time will give you the opportunity to practice with it before surgery, so you can manage better at home after surgery. Equipment. Using the toilet. Raised toilet seat. You may use a raised toilet seat and armrests or a commode chair. Back up until you feel the toilet with the back of your legs. Grasp the armrests and bend your knees. Slide your operated leg forward. Lower yourself gently to the toilet. To stand up, do the reverse. Bathing. Tub bench, shower seat. Do not attempt to sit in the bottom of the tub for at least 3 months. A walk-in shower is easiest to use. Have a shower or tub seat to sit on and a non-slip bath mat on the bottom of your shower or tub. If you use the tub to shower, you may need a tub transfer bench that has 2 legs inside the tub and 2 legs outside of the tub. You will sit on the bench from outside of the tub and swing your legs in. Do not bend forward to reach your feet or the faucet. Try to arrange to have your coach assist you when you are showering or using your tub bench. You may need a grab bar to steady yourself while you get in and out. You can purchase a long-handled sponge to wash your lower legs and feet. Do not pull or lean heavily on towel rods, soap dish holders, shower curtain rods, or anything else that could be pulled off the wall. A shower head extender may make showering easier. What to have ready before surgery. Here is a short list of suggestions on what to bring on the day of surgery. A list of medications, walking shoes with non-slip soles that give your feet and ankles firm support, loose-fitting clothing or walking shorts, toiletries such as toothbrush, toothpaste, hairbrush, electric shaver if you use one, dentures, eyeglasses or hearing aids, any assistive devices such as your walker or long-handled reacher, a CPAP machine if you use one, entertainment such as a book or your phone and charger. Do not bring valuables such as jewelry or large sums of money or medications with you to the hospital. The hospital is not responsible for lost or stolen items. You will need to remove all jewelry, dentures, glasses, contact lenses, artificial body parts, nail polish, and makeup before surgery. All your items will be taken to the surgical unit that you will be going to after your surgery. Day of surgery. On the day of your surgery, be sure to follow the instructions that were given to you at the pre-admission clinic. Give yourself enough time to park and find where you are going. Once you arrive in the surgical department, staff will begin getting you ready for your surgery. Your blood pressure, pulse, and temperature will be taken, and you will be asked to change into hospital clothes. An intravenous or an IV line will be started, and this is used for any fluids or medications given during your hospital stay. Anesthesia.
For your surgery, you will meet with doctors who provide you with the anesthesia called the anesthesiologist. And they will talk to you about 2 options, a spinal anesthetic and a general anesthetic. Spinal anesthetic is when we put freezing medicine in your back. The medicine will freeze your legs so you won't feel anything during surgery. There are some risks, but they are rare. They include back pain, nerve damage, bleeding, infection, and sometimes a headache. If you choose a spinal anesthetic, you can choose to stay awake for your surgery or have some medicines to make you feel sleepy. Even if you are awake, you won't see the surgery or feel any pain. The other option is a general anesthetic. They will give you some oxygen to breathe and some medications to make you go to sleep. Once you are asleep, they will put a breathing piece in your airway. After the surgery, when you are awake and able to protect your airway, they will remove that breathing piece. Risks of a general anesthetic include sore throat, dental damage, feeling sick, and feeling confused or groggy after surgery. Often we like to use a spinal anesthetic because it will decrease blood loss and help reduce pain after surgery. But you and your anesthesiologist will discuss what they think is right for you. There are lots of ways to help with pain after surgery. There are lots of medicines that can be used, but there is also freezing we can give you to help with the pain after. One type of freezing is called a nerve block. They will put freezing in your thigh, and this will make the area in front of your knee numb for 12 to 24 hours and help you need less pain medicine later. There are some risks with the nerve block, like infection, bleeding, and nerve injuries. The other type of freezing is called a periarticular block, and this is done by your surgeon during the operation. This freezing goes all the way around the knee joint to help with pain. The periarticular block can be done by itself or along with the nerve block, depending on your preference and with guidance of the surgical team.
After surgery. After your surgery, you will go to the post-anesthetic care unit, where you will stay until the anesthesia wears off. Then you will be taken back to the ward where you will receive physiotherapy, medications, and can have visitors. It's normal to feel pain after surgery, which may be different from your current pain. The medication for pain can be in pills or through an IV, and our goal is to switch you to pills before you go home. The medications may be scheduled or given as needed, depending on your pain level. You'll be asked to rate your pain on a scale from 0 to 10, with 0 being no pain and 10 being the worst pain. Our goal is to manage your pain at a level that you can handle while still being able to move. It's common to have an upset stomach after surgery, but we'll provide medications to help you with that. Let the staff know if you feel sick. After surgery, you can eat and drink if you're feeling well. Pain medications and bed rest can slow down your bowels, causing constipation or gas. Being as active as possible, drinking plenty of fluids, and eating fiber can help with bowel movements. We can provide medication for constipation if needed while you're in the hospital, and you can even take them at home if you need. After surgery, you will have a bandage on your hip or knee. Under the bandage is the incision made by the surgeon. The incision may be closed with surgical staples, steri-strips, or stitches. The bandage may be changed in the hospital or kept on until the staples are removed, depending on your surgeon's instructions. The hospital staff will teach you how to care for the bandage once you go home and what to watch for in terms of drainage, redness, and bruising. Sometimes it may be difficult to urinate, but standing, using a commode, or walking to the bathroom can help. If there's too much fluid in your bladder, a catheter may be inserted to empty it, but it's usually removed right away to prevent bladder infections. It's normal to have swelling in your legs after surgery, especially if they dangle too much. To reduce swelling, you can elevate your legs, use compression stockings, or apply a tensor bandage if it doesn't irritate your incision. A good way to elevate your legs is to lie down with the head of your bed flat and place pillows or a wedge under your entire leg. Make sure your foot is higher than your heart. Keeping your knees straight while elevating and doing ankle pumps and circles usually works best. You can also use ice while elevating. After surgery movement. It is important to get up and moving as soon as you can after surgery. Both having surgery and lying in bed can cause your lungs to not fully expand, and this can lead to fevers or even infections. We will ask you to do breathing exercises after your surgery and to get up standing as soon as it is safe to make sure your lungs are getting nice and full. Deep breathing exercises. Sit in a chair or up in bed. Inhale deeply through your nose. Without exhaling, take 3 small sniffs to fill your lungs. Hold 2 to 5 seconds and exhale. Do this 10 times every hour that you are awake while in hospital. Another reason to get up and moving quickly is to decrease your risk of blood clots. When you are resting more than normal, your blood doesn't flow as well, and this can lead to blood clots and infections. To prevent this, everyone who has a hip or knee replacement will receive blood thinning medication for 2 to 4 weeks after surgery. We will also show you foot and ankle exercises to do while resting to help keep your blood flowing. Ankle pumps. Pump your feet up and down. Do this 10 times every hour that you are awake. Ankle circles. Rotate your feet in each direction. Do this 10 times every hour that you are awake. Knee squeezes. With your legs straight out in front of you, squeeze the muscles on the front of your thighs and buttock muscles. Hold for 3 seconds. Relax. Repeat 10 times, 3 to 4 times every day. Sitting in a chair. Sit with your knee bent and your foot flat on the floor for short periods of time. To sit down, back up until you can feel the chair with the back of your legs. Slide your operative leg forward. Grasp the armrests and bend your knees. Lower yourself gently into the chair. To stand up, reverse the procedure. Getting in and out of bed. To get into bed, sidestep towards the head of the bed. Place your operative leg slightly forward. Place your hands back and sit down. Angle your back towards your pillows. Bring your legs into bed while easing yourself down with your arms. Do the reverse for getting out of bed. Getting dressed. Putting on underwear, pants, socks, and shoes will be difficult. Sit on the side of the bed or a chair with feet flat on the floor. Dress the operative leg first and undress it last. You may need the following if there is no one to help you dress: a sock aid, a long-handled shoehorn, a long-handled reacher. Sleeping. When lying on your back, do not use pillows under your knees. This will keep them bent, and it is important for you to straighten your knee and hip completely. When lying on your side, place 1 or 2 pillows between both your knees and ankles to help your leg relax and support your hip. Immediately after your surgery, you will need to put weight through your operative leg to help it heal. In the first few weeks after surgery, the most important thing to do is to learn to walk properly and stand up straight. It's great to do exercises and get stronger, but the most important thing is to move safely without risking a fall. Being active will help prevent you from getting stiff and sore. Changing positions and standing will really help with pain and stiffness. Before getting out of bed the first time, call for assistance. During your hospital stay, you can always call for assistance if needed. For hip surgery, it's best to avoid bending or twisting your new hip too much at first. You can move it within a level of pain that feels reasonable and comfortable. Your surgeon and physiotherapist will give you specific instructions to follow, as they may have particular movements they want you to avoid. In knee surgery, the most important task at first is to improve the range of motion in your knee. Straightening it fully is the most important, followed by bending it as much as possible. Climbing stairs. You will learn to climb stairs before you leave the hospital. Going up. Hold the handrail with one hand and a cane or crutch with the other. Step up with your strong leg, then bring your operative leg and cane up to it. Going down. Hold the handrail with one hand and a cane or crutch with the other. Step down with your operative leg and cane, then step down with your strong leg. Discharge home. To go home after your surgery, there are a few important things to do. First, your pain needs to be well managed so you feel comfortable. Second, you should be able to move around safely. This means being able to get in and out of bed without any problems, having a plan for dressing and walking safely, being able to walk enough distance to take care of yourself at home, and being able to handle stairs if needed. It is important that your coach is present the day of your discharge home to listen to instructions and give you a ride home. Before you leave the hospital, your nurse, therapist, coach, and you will go over the instructions for when you're discharged. Getting in and out of the car. When your driver picks you up. Make sure the seat is above knee height. You may need a firm cushion on the car seat. Put a large plastic bag on the seat so the surface is easy to slide on. Move the seat back as far as possible and recline it slightly. Readjust the seat once you're in the vehicle. Back up to the car seat, hold onto the door frame, not the door or your walker. Slide your operative leg forward and sit down. Lean back into the partially reclined seat and swing your legs into the car. To get out, reverse the process. Some people can go home on the same day as their surgery, while others might need to stay for 1 or 2 nights. Hospital discharge checklist. Make sure you check all items before you go home. Make sure you have confirmed your ride home, know how to take care of your incision, Know what your medications are supposed to do and when to take them. Your exercise program to follow. How to follow your movement guidelines as outlined by your surgeon. The signs that mean you need immediate medical attention. You have information about your follow-up appointments with your family doctor, physical therapist, and surgeon. Have a signed copy of your discharge instructions, and have arranged for all the equipment you need. At home. After surgery, you should be careful not to lift anything too heavy. As you heal, you can gradually increase the weight you lift, but do it slowly. Avoid activities like jumping, twisting, or sudden starts and stops at first. Discuss with your surgeon before participating in contact sports. Once your strength and stability return to normal, your surgeon may allow you to engage in more vigorous activities. After joint replacement surgery, most people start feeling much better within 6 months. But did you know you can keep improving for many years? Your surgeon will give you special instructions based on your age, strength, and type of replacement you had. They can tell you what activities you can do and what to avoid. You'll be happy to know that swimming, golf, cycling, exercises in water, easy hiking, and gentle workouts are usually good for you. The surgery's goal is to help you move better, have less pain, and feel great. To stay healthy and take care of your new joint, it's important to keep your weight in check and work on getting stronger and standing correctly. You have been waiting for the surgery for a while, so be kind to yourself and be patient. We wish you good luck on your journey to feeling better.